Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. We have a lot to cover. Let's get right to it. Scientists have identified a natural compound found in flowers that halts the process involved in the progression of certain forms of cancer, including multiple sclerosis. Joining us to discuss is Larry Sherman, PhD, professor in the Division of Neuroscience at OHSU's Oregon National Primate Research Center. Thank you for joining us, Dr. Sherman.
Pleasure to be here.
So, Dr. Sherman, why don't you tell us about this plant-derived compound called, is it sulfuretin, and where it's found, and what exactly does it do?
Right. So it's called sulfuretin, and it's a compound that has been identified previously, but nobody had any idea about these particular properties of it. And the story of how it was found and why it was found goes back to research from my lab from many years ago. We've been trying to understand why patients who have diseases like multiple sclerosis, why their brain doesn't repair itself. And we know that in early stages of MS, and MS is a disease where your immune system actually attacks your nerve cells. In early stages of the disease, the brain actually does repair itself. But as the disease progresses, it stops happening. And so people with MS have problems with movement, problems with feeling, and even problems with thinking and memory. And so what we're trying to figure out is how can we repair the brain? And so we identified a process and an enzyme in particular, and it has a name. Don't worry, there's not going to be a quiz. It's called hyaluronidase. And this enzyme is actually producing products in the brain that stop the cells from doing their job, basically. And so we were trying to find a compound or a drug that could block this enzyme specifically. There's a professor from the University of Portland, which is just down the road from us, who also happened to be, she's a PhD chemist, and she also happens to be a nun, which is kind of amazing. And she actually was one of the people who discovered another plant-derived product called Taxol, which is used in cancer therapy. And she said, hey, can you show us how to measure the activity of this enzyme? And some of our undergraduates, we grind up plants and we try to find things within plants that block the activities of enzymes and other things. And I said, sure. And over the years, nothing came to that. And then about 3 years ago, she came to us with this really promising compound. We didn't know what it was then. And so people in my lab characterized it and showed that, in fact, it had two really interesting activities. One of them was it did the job we wanted it to do, which was to block this enzyme, and it promoted the ability of these cells to mature and repair the brain. But it also had some anti-cancer activities. And then we figured out that it was this compound sulfuretin. And the plants that we found it in are the flowers of dahlia plants, and also some other plants as well. But nobody had known that this compound had this activity before, and it was very exciting.
That was literally going to be my next question is, what flowers? Because, that's a pretty wide umbrella term. And, is it found in a lot of other plants? And
it's found in a couple other plants. But the ones that we identified it in were ones that we didn't know about. And that was dahlias and coreopsis. So that was really exciting, but also nobody had attributed this activity to it before. But I don't want your listeners to go out and start eating dahlias because there's other things in those flowers that are not good for you. So
we're going to take a quick break. We'll be right back with Dr. Sherman after this. You are watching American Medicine Today. Don't be screwed by lesser spine institutes who bait you with minimally invasive procedures, then switch to screws, rods, disc replacements, and hardware. At Bonati, no metal hardware fusions are ever used. Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. Over half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Welcome back to American Medicine Today. We're continuing our discussion with Dr. Sherman.
Well, I remember reading a long time ago, I was always obsessed with the Amazon rainforest when I was growing up. And a lot of people seem to think that pretty much the Amazon is like Earth's drugstore or Earth's pharmacy, that pretty much the cure for any ailment that humans have can probably be found not only in just the Amazon, but in nature itself.
Right.
What are your thoughts on that take?
Yeah. So, I mean, the reality is we've known for a long time that there are natural compounds, and a lot of the drugs we use today are based on natural compounds that have been found in plants and other places. Also, think about penicillin. That's a natural compound, right? The thing is, like this drug, sulfuretin, it probably wouldn't make the best drug, partly because it needs to be changed chemically to make it get to the brain better and to not disappear from your metabolism quickly. You want it to hang around for a while. And it may have some side effects that we would need to deal with, right? So, but I think the nice thing about this is we've been using nature's drugstore, as you will, as the basis for developing better drugs for a very long time. And I think this kind of research is really important, and it's ongoing.
Do you ever foresee that this will be turned into a compound for humans to ward off potential cancers and MS, or would this only be used to treat it once it's developed?
Yeah, so it's not something that's going to necessarily prevent the symptoms of MS. And the cool thing about that is right now, I mean, when I started working on MS 25 years ago, we had only one real drug for it. And now there's over 27 or 8, and those drugs all kind of more or less do the same thing. It stops the immune system from crossing into the brain and attacking the cells and causing all this damage. So the nice thing is now with MS, once it's diagnosed, and that's kind of a tricky issue too, because it takes a while to figure out you have it, there are good ways to really slow this disease down. So people are living longer and better with MS now than they ever have because of those drugs. But the problem is once you've been diagnosed, there's already quite a bit of damage. And so our question is, can we now also, in addition to stopping additional attacks, repair the damage and help people who are having some disability? And that's really our goal.
And I see that this compound is also useful in something called demyelination. Can you explain what that is and how it sort of prevents that from happening?
Yeah. So what we were talking about when I mentioned repairing the brain is actually specifically the effect of demyelination. So our nerve cells are the electrical units of the brain, and they're surrounded by this substance called myelin. And basically it's like insulation. So if you have myelin in your nerve cell, I can only give you references to highways I've driven on. And in Florida, I've only been on, I think, 75. But think about the worst traffic you've ever had on any highway at rush hour. So if you lose your myelin, it's like driving on that highway at rush hour. But if you have myelin, it's like driving on the Autobahn in Germany at midnight where there's no traffic and no speed limit. So you could go 200 miles an hour and no one's going to stop you. So losing that, imagine what that's going to do to signaling between different parts of your brain. It's going to slow everything down. And that's what causes these movement problems and these problems with feeling and problems with thinking. The other problem is when you lose myelin, nerve cells become very sensitive to additional damage. And so after a while, those nerve cells will actually start to die off. And so that adds to an additional level of disability. So getting that remyelination to happen, bringing that back, that's what the sulfuretin seems to be doing. It's taking cells that are kind of inhibited from turning into myelin-forming cells and allowing them to become myelin-forming cells and repair the damage.
You're testing these compounds, or you're about to test these compounds on animals. Is that correct?
So we are very lucky in Oregon. We have a collection of Japanese snow monkeys, and they've been there for quite a while. And sometime in the 1980s, they started developing just on their own a disease that looks very similar to multiple sclerosis. And so we've already shown that this drug works very nicely in mice, but a mouse's brain is only this big. And a lot of drugs that have been targeted towards brain repair and tested just in mice have not translated well when they were taken to humans. So the Japanese snow monkeys are much closer to us. And so my goal is to try to repair the brains of these animals. If I can actually give them a therapy that helps them recover from this disease, I think we have a very good chance of taking that to a human clinical trial. And so right now our next steps are to make sulfuretin a better drug And then once we've done that, try to see if we can reverse this process and this disease that's a naturally occurring MS-like disease in the monkey. And then I have colleagues I'm talking into who do more cancer-related research to try to understand the anti-cancer properties of sulfuretin as well.
Well, thank you so much, Dr. Sherman, for helping so many people that are combating MS and cancer with this new natural compound found in flowers.
Thank you so much.
Well, that's all the time we have for this segment. Make sure you stay tuned. We'll be back after the break. You are watching American Medicine Today.
To be 50 years old and told you're going to live like a cripple was painful. So I was ready to get something done. There's options out there, and never give up. Literally, I went and walked probably a block about 2 o'clock, 3 o'clock that afternoon. I noticed it immediately.
That's Jason now, but for almost a decade, he found it difficult to work or to be active with his family and friends. So he decided it was time to put a stop to his pain. Today, thanks to the exclusive Bonati Spine Procedures, he is back at work and enjoying life again, pain-free.
It was degenerative. There wasn't anything specific that I remember, but this has been gone for some time. Most of it was from my lower back and occasionally shooting down my left leg. Constant discomfort. Standing, sitting, walking. It was on occasions it would shoot down my leg where it was actual throbbing or something like that, but mostly just a constant lower back pain. It was like, I don't know, a level of pressure shoving against my spinal cord. I actually have a basketball court at my house. We play indoors all winter long. And I had from college friends to high school buddies that we've known for 35 years. But we would play weekly. And the last 2 years, I told them, I said, listen, I got to step away. I got to walk away from this. So golf, I'm never great. The lowest, I was a 9 handicap at one point. Last summer, I think I finished in August as a 16. That was frustrating, but I just didn't feel like playing. That lower back, it really bothered my whole life. Not just activities, but the work I did.
Prior to learning about the Bonati Spine Institute, Jason tried conservative treatments to relieve his pain.
I tried everything, from chiropractors to massage therapy. I had 3 cortisone shots in 12 months' time. The first one, I felt pretty good for about a month, but then it was right back where it was. The second time, I really walked out. The next day, I didn't feel much different. And the third was about the same. From pain management at this OSMC, they recommended to visit the surgeon with all my photos, all my MRIs, all that stuff. And that's when he told me just chalk it up to old age. You know, there's nothing surgically he could do whatsoever. Try to deal with it. The depressing thing is when you walk out of a supposed expert's office and they tell you, you know, suck it up. I can deal with a lot. I have for some time, but to give up, I'm not one to quit.
Not satisfied with the diagnosis from his hometown doctors, he started researching other alternatives.
And that's really when I kind of went on my own to just start doing my own research and getting online and visiting everything from actual replacement disc surgery in Germany. You know, the idea of that. There was also another spine place in Houston I visited, but after speaking with Dr. Bonati's office, I was clear that that was probably the route that I wanted to go.
Jason sent his imagery in for evaluation to determine if he was a good candidate for the patented Bonati Spine Procedures.
After my phone conversation, when they finally saw my MRI and they were describing to me where my pain was, and I was in Indiana, they were looking at my MRI in Florida, I quickly deduced that these are highly educated method type answers. And that was really quick to me. So I guess I was ambitious to get there and get it done. They were like, actually, I think I got noticed like, well, can you be here in 4 days? I had my bags packed and I was on my way.
Like many after their targeted Bonati Spine Procedures, Jason was surprised at just how fast he was able to be up and walking.
When I walked out of the surgery the same day, just a few minutes after the procedure, I climbed into a vehicle and almost immediate, like a relief, a big brick off my chest.
At the Bonati Spine Institute, after their procedure, patients are not required to wear uncomfortable braces or endure weeks of physical therapy. Instead, they are instructed to simply walk for about 40 minutes a day.
I walk about a mile a day right now, but I'm on my feet a lot during my work day.
Jason highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
There is help. There's options out there, and never give up.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. That's all the time we have for this episode of American Medicine Today. Remember, you can check out previous episodes anytime, anywhere by adding American Medicine Today to your favorite streaming devices. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.